In the last 20 years, something remarkable has been noticed about child development. Something once rare is now encountered in almost every school today: autism. Today, 1 in every 36 children born in America is on the autism spectrum. Is this an epidemic? Is modern life the cause? Or is the reality actually quite different? In this video, we'll explore what autism is, why it's diagnosed more often, and the questions scientists are still seeking to answer. Autism Spectrum Disorder. It is not a disease. It is not an infection. And contrary to what most people think, the word disorder is often misunderstood here. Autism is a difference in how the brain perceives the world. A person with autism may feel sounds differently. They may interpret social cues differently, and they can notice details with extraordinary strength. That's why scientists today define autism as neurological diversity rather than a deficiency. The most important feature of autism, it is a spectrum. While some individuals need support in daily life, others can be university professors, yes. There are autistic software developers, artists, and scientists. This is why there is no longer a single autism type. Every individual is unique. Research shows that globally, approximately 1 in 100 children are on the autism spectrum. However, in extensive follow-up studies in the US, the rate is 1 in 36. This number worries many parents, because in the 1980s, the rate was about 1 in 2,000. So, has there really been a 40-fold increase? Scientists make a very important distinction here. It's not that autism is increasing, it may be our ability to diagnose it. First, diagnosis criteria have changed. In the past, only severe cases were noticed. Today, even mild social differences are evaluated. Second, the awareness revolution. Teachers, parents, and doctors now know the early signs. When a child is delayed in speaking, instead of "let's wait," an evaluation is performed. Third, health systems have improved. Developmental screenings are now routine. This means more children are being seen. And fourth, masked individuals. Especially girls often didn't receive a diagnosis in the past. Today, science is just realizing this difference. Autism symptoms usually appear between 12 and 24 months. Signs to watch for: not responding to their name, avoiding eye contact, not pointing, lack of imitation behaviors, speech delay. But an important fact: a single symptom does not mean a diagnosis. Autism evaluation is performed multidisciplinarily. The strongest factor scientists agree on: genetics. Hundreds of genes can affect development. Research also examines advanced parental age, premature birth, and pregnancy complications. But the scientific consensus is clear: vaccines do not cause autism. This claim was born from flawed research and has been debunked repeatedly. One of the biggest misconceptions in society, thinking autism is intellectual disability. In reality, some individuals may experience learning difficulties, while others have superior cognitive abilities. Features like noticing detail, system thinking, and intense focus provide advantages in many fields. Autism is not a disease that needs to be treated, but support is very important. Scientifically effective approaches, early special education, speech therapy, behavioral interventions, and family training. Potential for development increases significantly with early support. The world now sees autism not as a condition to be fixed, but as a difference to be understood. The concept of neurodiversity is becoming increasingly widespread, but there is still much to do in education systems, business life, and social acceptance. Finally, the closing. The most important thing we learned today is this: autism is not a newly emerging condition. We just see it better now. We notice it earlier, and we can give better support, because correct information changes lives.